Hey all, welcome back to the Real Life Pharmacology Podcast. I'm your host, pharmacist Eric Christensen. Thank you so much for listening today. Today I've got the drug benzonatate. Brand name is Tessalon Pearls. Before we get to that, just want to remind you, if you're new to the podcast and listening to it, we've got well over 350 episodes at this point. Basically 100 hours of educational content. So all that's free and available. You can find it on iTunes, Spotify, wherever you listen to podcasts. You can also find all these episodes at the Real Life Pharmacology Podcast.com. So go check that out. Help get some education, free education, and take advantage of that and share us with friends, colleagues, classmates, and so on and so forth. So with that said, let's get into the drug of the day, and that is benzonatate. Brand name is Tessalon Pearls, as I mentioned. This is considered an antitussive medication. Fancy name for basically meaning that we're trying to treat and suppress a cough. Okay? So, first off, starting with cough, whenever I think of cough, I typically think of medical conditions that are going on that are usually going to be associated with that cough. And obviously this is something that's going to be diagnosed by a provider, but it could be infection, it could be allergy-related, asthma, COPD, those respiratory diseases, GERD, could be various types of lung cancers. So these can all be potential contributors to cough, certainly, and in any kind of differential diagnosis, that's what a clinician is going to do, is take a look at that and make sure that we know what's causing this cough. As a pharmacist, there are numerous medications that can cause lung issues, coughing issues. First and foremost, it's the ACE inhibitors. So if you see lisinopril or anything like that, you got to make sure that that's ruled out, particularly in anybody that's experiencing a cough for 1, 2, 3 weeks plus. Definitely, there is potential that it could be an ACE inhibitor. Usually, this is going to happen when we start or increase the dose, but in rare cases I have seen it where it's later on. The patient just notices, or it happens after the fact or the initiation of the medication. So pay attention to that. There's also other meds that can cause pulmonary issues. Amiodarone's a good example. Nitrofurantoin in rare cases can cause some lung issues. So those are other meds to take a look at if somebody's having some breathing difficulties, maybe some cough associated with that. Making sure we're ruling out medications, obviously in addition to some of the medical conditions as well that may contribute to a chronic cough. So how does this medication work? Benzonatate, it suppresses the cough through peripheral action. Essentially what it does is it provides a local anesthetic type effect, and it's actually got a similar structure to some of the canes like Procaine and Tetracaine. So those are basically local anesthetics, right, or provide that anesthetic relief. And that's essentially what this medication does kind of in the throat and coughing area, reflex, respiratory tract. That's where this medication is working. Now, importantly, this is a localized effect. So if those Tessalon Pearls or the benzonatate capsule is broken, if it's dissolved in the mouth a little bit, it can cause kind of that temporary local anesthesia type effect on the oral mucosa, so the mouth, for example, and the throat. And if it does that, we may have some issues with swallowing in the short term. So basically, the important patient education piece here is if a patient experiences some of that, mouth numbness and tingling in the, tongue, mouth, throat, it's recommended to refrain from oral ingestion of food or liquid until we feel that numbness has resolved. And obviously, this is, to prevent choking and things of that nature. All right, dosing of this medication, typically 100 to 200 milligrams 3 times a day as needed for cough. Maximum daily dose is around 600 milligrams per day. It's not recommended to use this medication in children less than 10 years old. biggest reason, there has been cases of accidental ingestion, fatal overdose. But typically, patients under the age of 10 aren't that great at swallowing medications. And, they may have that issue of them kind of dissolving the medication in their mouth. And, that may lead to some issues of, choking risk and things like that as well. So maybe a couple reasons there why this medication is not going to be recommended in younger kids. Adverse drug reaction profile is pretty well tolerated in general. I alluded to the oral mucosa numbness, mouth numbness, those type of things, so I'll refer you back to that if you want to listen to that. There are some rare case reports of some CNS changes like hallucinations, somnolence, confusion. I would say that's probably more likely in patients that are overusing the medication or inappropriately using the medication, but there have been some case reports out there as well. All right, monitoring parameters. Obviously, we're just looking for symptom relief and any type of side effects. Pharmacokinetics, so good patient education point here. Onset of actions 15 to 20 minutes typically, so that's a great number for our patients to start experiencing that relief pretty quickly if they're going to have relief. So we can educate them about that. And then that duration of action anywhere from 3 to 8 hours, which that totally aligns with the medication and how frequently it's dosed, right? We can give it 3 times a day there. All right, let's take a quick break from our sponsor and we'll wrap up with drug interactions. If you're in the market for any pharmacist board certification study material like BCPS, ambulatory care, BCMTMS, geriatrics exam, or NAPLEX, go check out meded101.com/store. We've got tons of resources there that have helped thousands of pharmacists, pharmacy students pass their board exam. So go check that out. Support the sponsor, meded101.com/store, STORE. All right, wrapping up with drug interactions, I don't have a ton to say here. This medication, again, it's kind of working locally. You're not going to have a ton of drug interactions there. Probably the biggest thing I'd tell you to look out for is those drug-induced causes of coughing and respiratory issues, which I alluded to in amiodarone, nitrofurantoin, and of course ACE inhibitors. That's your number one candidate when we're talking about a drug-induced cough. One other one I might mention, if you've got a patient with asthma that's historically been controlled, and then we start a beta blocker, particularly maybe a non-selective one like propranolol, that's maybe a situation where that respiratory status could worsen, and that may present with a patient that's coughing a little bit more. One last one I will mention is sometimes when we're tapering off, deprescribing PPIs, cough can be kind of an atypical symptom of GERD, kind of that irritation, to the throat, the regurgitation, that may cause some coughing. So that might be one other thing to kind of take a peek at and look at, is if, maybe a patient, we've just tried to get them off their PPI and, maybe the symptoms are presenting with a little bit of atypical GERD symptoms in cough. So again, not something I see incredibly common, but definitely something to think about there. All right, well, that's going to wrap up the podcast for today. Thank you so much for listening. Go take advantage of the free 31-page PDF on the top 200 drugs. Great study guide, great refresher. Simply an email will get you access to that when you subscribe to getting new podcast episodes and other updates. So you can do that. Find that at reallifepharmacology.com. Again, free 31-page PDF on the top 200 drugs. If you like this podcast, enjoyed it, do me a huge favor. Leave a rating review on iTunes or Spotify or wherever you're listening. Greatly appreciate that. And of course, share us. Friends, colleagues, classmates, students that you work with, anyone that can benefit from some pharmacology education. All right. If you want to track me down, Eric Christensen, PharmD, BCPS, BCGP on LinkedIn, or feel free to email me at mededucation101@gmail.com. Thanks so much for listening. Take care, and I hope you have a great rest of your day.